A 54-year-old man was recently diagnosed with tuberculosis, presents to his primary care provider as a part of his routine monthly follow-up. He is currently in the initial phase of anti-tubercular therapy. His travel history is relevant for multiple trips to Southeast Asia as a part of relief missions. His medical history is positive for diabetes, diagnosed 5 years ago. The physical examination is unremarkable, except for a visual abnormality on the color chart. He is unable to differentiate red to green. The physician suspects visual irregularity as a sign of toxicity due to which of the following drug treatment regimens? Which of the following is the mechanism by which this medication acts in the treatment of Mycobacterium tuberculosis? So your options are A, inhibition of mycolic acid synthesis, option B, inhibition of DNA-dependent RNA polymerase, option C, induction of free radical metabolites, and option D is inhibition of protein synthesis by binding to 30S subunit, and option E is inhibition of arabinosyl transferase. I'll go with the majority answers. 55-year-old man diagnosed with tuberculosis and travel history was there to Southeast Asia. So yes, and his history is positive for diabetes, so he's immunocompromised also. He has tuberculosis travel history. The travel history kind of explains the tuberculosis, right? And now what they want to know is why the visual irregularities are there due to which of the drugs. So the drug you can identify, everyone can identify, which is ethambutol. So this is like the first order question, but then USMLE is not about first order questions. They will give you a second order something or the third order question where they'll ask you the mechanism of action. So the mechanism of action of arabinosyl transferase is of ethambutol is inhibition of arabinosyl transferase, which is a part of the cell wall. So basically, what ethambutol does is it blocks the cell wall synthesis by inhibiting this enzyme called arabinosyl transferase. As a result, it will prevent polymerization of the carbohydrates, due to which the cell wall would not form properly. All right, is that clear? It's that much only. And a simple way to remember this, which I can tell you, is see, ethambutol starts with E, so you can remember it as ithambutol. EYETHAM-butol. Same, the spelling of ethambutol. Just remember the E for E in ethambutol stands for I. So usually when they're talking about eye effects, so they are basically referring to ethambutol. All right. Then I think I'll discuss option Y. So option A explains which drug used in tuberculosis. Quick, I need answers from you. I can discuss, I can go on, but I need answers. Inhibition of mycolic acid synthesis is done by which drug? All right, very good. So it's isoniazid. All right, then we go to option B, inhibition of DNA-dependent RNA polymerase. Quick, very good. Rifampin. And option C is not really in the tuberculosis part, so don't worry about it. Basically, in induction of free radical metabolites can be in metronidazole and all, right? And that's all, I think. Yeah, I think I missed one more. Option D, inhibition of protein synthesis by binding to 30S ribosomal subunit. Which drug involved in tuberculosis? All right, very good. Streptomycin. Okay, so you have to know the importance in this question is you have to know the functions of all the drugs. As far as pyrazinamide is concerned, according to your old first aid and other research papers, it's not really fixed, the mechanism. But right now they have come up with something that it's like a pyrazinamide is a prodrug that is converted to its active compound, which is pyrazinic acid, which works as it's at an acidic pH, all right, and it disrupts the metabolism of the cell. Okay, so once it disrupts the metabolism, eventually it leads to the death of the bacteria. All right. So also with this, I would like to ask you a few more things. Quick side effects of isoniazid. Since these are all high yield, so it's better I discuss them then and there. It'll help you out. Very good. More. Excellent. All right. So going by what is there in first aid, UWorld, and whatever I have noted down. So the most common which they test you everywhere is hepatotoxicity and drug-induced SLE, which I think most of you have mentioned. Then you have vitamin B6 deficiency, very good, which leads to peripheral neuropathy. These are the three which they always test you on most of the places. And then other things can be seizures, all right, which are refractive to benzodiazepines, all right. Then we come to the next drug, which is your rifampin. Quick side effects of rifampin. Yes, not really a side effect, but yeah, red urine, orange secretions, whatever you can say it as. Okay, but not as many side effects. Main thing you need to know about rifampin is it induces cytochrome P450 activity. It's an inducer, P450 inducer. All right. We have discussed isoniazid, rifampin, pyrazinamide. Anyone would like to tell me the side effects of pyrazinamide? Very good. Hyperuricemia, hepatotoxicity. Hepatotoxicity can be for all of them, but hyperuricemia is more specific for pyrazinamide. And ethambutol we have discussed is the eye optic neuropathy, right?
Thanks for watching. Please give a thumbs up and subscribe for more.